Very good morning, dear students. As we planned and discussed that today we'll discuss the mood disorders. In mood disorders, the important topic we'll discuss is depression. In depression, the important point about depression, number one, they can ask male-female ratio 1:2. The onset in depression is middle age onset. Middle age means around 35 to 40 years of age. 35 to 40 years of age. If they ask you etiology, the important point about etiology is biochemical theory. In biochemical theory, 2 MCQs. If they ask you the main neurotransmitter decrease level of serotonin, but apart from serotonin, dopamine and norepinephrine also decreases. So decreased level of serotonin, dopamine and norepinephrine also decreases. So which of the following, if they ask, then the all 3 neurotransmitters, and the main neurotransmitter, then answer is serotonin. If they ask genetics, the prevalence in general population is roughly 5 to 17%, very high. One parent suffer from depression and both parents suffer from depression. One parent 10 to 25%, both parents chance get double. Okay. The MRI finding is important one. They can ask decrease blood flow in left dorsolateral prefrontal cortex. Decrease blood flow in left dorsolateral prefrontal cortex. And basal ganglia, and increase blood flow in amygdala. So decrease blood flow in left dorsolateral prefrontal cortex and basal ganglia, and the increase blood flow in amygdala. Okay, that they ask. Cyclic AMP response element binding protein. CRAB element, cyclic AMP response element binding protein, is associated with chromosome 2. Is associated with chromosome 2. Cyclic AMP response element binding protein, CRAB element associated with chromosome 2. This is actually the mutation in this CRAB element is responsible for unipolar depression. That's important. Very important point they can ask. CRAB element. So decreased blood flow and metabolism in left dorsolateral prefrontal cortex and basal ganglia, increased activity in amygdala, cyclic AMP response element binding protein associated with the chromosome 2 mutation in this CRAB element is responsible for unipolar depression. Unipolar depression. Okay. This they ask that Aaron Beck has given the cognitive triad. Cognitive triad. In cognitive triad we have the person is having a negative self-perception, negative perception about the world, and negative perception about the future. Ideas of hopelessness, worthlessness, and helplessness. So that they ask cognitive triad of Aaron Beck. If we'll talk about diagnosis, in diagnosis we have a major criteria and minor criteria. Major criteria and minor criteria. Major criteria are the three major criteria: persistent sadness of mood, loss of pleasure in day-to-day activities, kind of anhedonia, and easy fatigability. So persistent sadness of mood, person is persistently sad, loss of pleasure in day-to-day activities, and easy fatigability. Before person was working 4 hours, 6 hours, 8 hours, then he used to feel fatigue. Now even indulging into the work or even without working, patient having a fatigability. The minor criteria are sleep disturbance, decrease appetite, decrease libido, ideas of hopelessness, helplessness, worthlessness, ideas of guilt, suicidal idea, and decrease attention and concentration. So sleep disturbance, decrease appetite, decrease libido, negative thoughts in the form of ideas of hopelessness, helplessness, and worthlessness, ideas of guilt. We have suicidal ideas also. Suicidal idea we cover under minor criteria of depression, because suicidal idea doesn't mean patient will commit suicide. Okay. And decrease attention and concentration. Decrease attention and concentration. Decrease attention and concentration we have in dementia also, and we have in depression also. But unlike dementia, when we treat the attention and concentration in depression, it improves. That's why we say pseudo dementia. Pseudo dementia seen in depression. Unlike dementia, in dementia it's usually irreversible disorder, but in depression, when you treat the depressive symptoms along with antidepressant, attention and concentration also get improved. So we say pseudo dementia seen in depression. How we make a diagnosis of depression? Point number 1, if they ask you duration, you will say 2 weeks. So minimum criteria for duration criteria for depression is minimum 2 weeks. Minimum 2 weeks. Okay. On the basis of severity, we divide the depression: mild depression, moderate depression, and severe depression. Mild, moderate, and severe. Mild, 2 major, 2 minor. Moderate, 2 major, 3 minor. And severe, 3 major, 4 minor. So mild is mild, 2 major plus 2 major plus 2 minor criteria. Moderate is 2 major plus 3 minor criteria, and severe is 3 major plus 4 minor criteria. Moderate depression with somatic syndrome and without somatic syndrome. So with somatic syndrome, without somatic syndrome. Moderate depression we divide with and without somatic syndrome. Somatic syndrome is we have like some specific symptoms are there for somatic syndrome, like early morning awakening, around 2 hours early, patient get up, then the usual one. Depression worse in the morning. In morning, patient will feel more worse compared to evening. We call it a diurnal variation. So in morning, patient will have more depressive symptom compared to evening. Diurnal variation. Psychomotor retardation, psychomotor agitation, significant loss of appetite, significant loss of libido. If the patient loses the roughly 5% weight loss in 1 month, we call it a significant loss of appetite and significant loss of libido. So early morning awakening, depression more worse in the morning. Psychomotor retardation, psychomotor agitation, significant loss of appetite, significant loss of libido. Currently we call it a somatic syndrome, moderate depression with somatic syndrome. Previously we used to call it melancholic depression. So guys, previously we used to call it a melancholic depression, involutional melancholia. Now we call it a moderate depression with somatic syndrome. That you have to remember. Once we have a 3+4 criteria, it means person is suffering from severe depression. Once severe depression is there, we assume that somatic syndrome is there. We never say severe depression with or without somatic syndrome. We say severe depression with and without. We say severe depression with psychotic symptoms and severe depression without psychotic symptom. Severe depression with psychotic symptom and without psychotic symptom. So severe depression with psychotic symptom, severe depression without psychotic symptoms. So once psychotic symptoms are there, we usually used to say that diagnosis is severe depression. But guys, please remember one update. And what is that update? That currently in ICD-11, ICD-11 claims that psychotic symptoms we have in severe depression, but psychotic symptom we also can have in a moderate depression. So psychotic symptoms we have in a severe depression, but psychotic symptom we also can have in a moderate depression. So ICD-11 claims that psychotic symptoms we have in a severe depression, but we also can have in a moderate depression. That's the update about ICD-11. So before we used to say that once psychotic symptom is there, always diagnosis is severe depression. ICD-11 first time, the 11th edition of ICD claiming that psychotic symptom along with severe depression can be a part of moderate depression. Okay. Okay. On the basis of severity, we divide mild, moderate, severe depression. Otherwise, we have types of depression. We have unipolar depression. We have bipolar depression. We have seasonal depression, and we have atypical depression. Unipolar, bipolar, seasonal and atypical. Unipolar depression without mania or hypomania. Patient currently having a depression, but in past patient never had an episode of mania or hypomania. Unipolar. Bipolar, we have a depression with mania or hypomania. So depression with mania or hypomania is bipolar. Depression without mania or hypomania is unipolar. So unipolar means single pole, only depression. So depression without mania or hypomania, unipolar depression. Currently, if we have a depression, in past patient had either hypomanic episode or manic episode, then we call it a bipolar depression. In unipolar depression, one more condition of unipolar depression is RDD, recurrent depressive disorder. In recurrent depressive disorder, guys, what happens? Currently we have a depressive episode. In past patient never had a hypomanic or manic episode, but in past patient can have a depression. So the minimum criteria for recurrent depressive disorder is if at least 2 depressive episodes and 2 months symptom free period between these 2 episodes. Why 2 months symptom free period? Because to call them separate depressive episode, 2 months symptom free period should be there. 2 months symptom free period should be there. So we have a 2 condition in unipolar depression: depression without mania or hypomania, and recurrent depressive disorder comes under unipolar depression. In bipolar, depression with mania or hypomania. In seasonal, we have at least 2 depressive episodes in 2 continuous years. At least 2 depressive episodes in 2 continuous years. At least 2 depressive episodes in 2 continuous years is what? Seasonal. And atypical what is atypical, which is not typical, like increase, patient having a increase appetite, hypersomnia, mood reactivity, and laden paralysis. Laden paralysis. If they ask you, the treatment of choice of seasonal depressive disorder, it's a light or phototherapy. Light or phototherapy. If they ask you the treatment of choice or atypical depression, the drug of choice is MAO inhibitor. MAO inhibitor. And dear students, that's why we divide the various types of depression, because their treatment strategy is different. So the treatment of choice in seasonal is light or phototherapy, and the drug of choice is atypical depression is MAO inhibitor. So unipolar, bipolar, seasonal, atypical. And we have postpartum depression. In postpartum depression, if the lady having a depressive episode within 1 month, if the lady having a depressive episode within 1 month after delivery, we call it a postpartum depression. So if the lady having a depressive episode within 1 month after depression, we call it a postpartum depression. Depressive episode within 1 month after delivery, we call it a postpartum depression. Okay. If they ask you, most common psychiatric disorder after delivery, your answer will be postpartum blues. Postpartum blues. Postpartum blues is different from postpartum depression. In postpartum blues, we have only irritability, we have crying spells, and sleep disturbance, crying spells, and irritability. Most common psychiatric disorder after delivery. These are the unipolar, bipolar, seasonal, atypical, postpartum. Even we have organic depression, we have any Parkinson disease or any organic comorbid condition. Along with that, if we have a depression, we call it a postpartum. It's a organic depression. Okay. The guys, we have physical sign in depression. We have auto-Vargat sign, and we have omega sign. Basically, patient, because of depressed affect, patient having a skin fold over the nasal corner in upper eyelid. Auto-Vargat sign, skin fold over the nasal corner in upper eyelid. Or omega sign is because of depressed affect, patient having a this over the frontal lobe, having this kind of omega sign. These are the physical sign in the depression. Omega and autovergat. If they ask you about the treatment, guys, in treatment, initially we have various groups. We have TCA, tricyclic antidepressant. We have SSRI, selective serotonin reuptake inhibitor. We have SNRI, serotonin norepinephrine reuptake inhibitors. Okay, we have selective NRI. So serotonin norepinephrine reuptake inhibitor is SNRI, and selective norepinephrine reuptake inhibitor is, we have different atomoxetine and reboxetine. So we have venlafaxine, desvenlafaxine and duloxetine comes under SNRI, and we have atomoxetine and reboxetine under selective NRI. We have NDRI, norepinephrine dopamine reuptake inhibitor. Norepinephrine dopamine reuptake inhibitor. Bupropion, and we have NASA, noradrenergic specific serotonergic antagonist mirtazapine. Also we have some new antidepressant, agomelatine, melatonin 1 and 2 agonist, and 5-HT2C antagonist. We have vilazodone, which comes under Spari. Okay, serotonin partial agonist reuptake inhibitor. And we have the one of the latest one is vortioxetine. So these are the groups we have: TCA, SNRI, SSRI, selective NRI, NDRI, NASA, agomelatine, vilazodone, and currently the latest one, vortioxetine. Various groups we have in detail in lectures I have discussed with you, and along with that currently we have treatment resistant depression. We have esketamine. It's actually we use esketamine, the nasal spray of esketamine we use in a treatment. It's FDA approved treatment in treatment resistant depression. Patients should use in a registered doctor clinic esketamine, FDA approved in the treatment resistant depression. Okay, we use non-pharmacological is CBT. Okay guys, cognitive behavior therapy as a non-pharmacological tool in depression. Apart from depression, we use in anxiety disorder like phobia and panic disorder, and we use in a eating disorder. So CBT is a very important non-pharmacological intervention in psychiatry. Okay, so this is about the depression. We covered the etiology, we covered the how we make a diagnosis on the severity basis: mild, moderate, severe depression. We have types of depression: unipolar, bipolar, seasonal, atypical, postpartum, and we have pharmacological intervention and we have non-pharmacological intervention. Okay guys, briefly I summarized for you, but I request you go through my videos properly. Psychiatry is a very important subject, and nowadays the minimum 9, 10, 11 MCQs are asking. Okay guys, so I hope you enjoyed this session. Tomorrow we'll have mood disorder part 2, the same time in morning 8 a.m. So please come. Tomorrow we'll cover the bipolar disorder and other mood disorders. Okay guys, so have a great day. God bless you. Study hard, be dedicated, and one day you will achieve what you want. Bye bye.